So we get to look at a very specialized needle, which is used in our hospitals. Okay, but this is mainly for taking up samples. So this is what is known as a Jamshidi needle. Okay, Jamshidi needle. So this is how a Jamshidi needle looks like. Please you can pause to observe it, right? It's how a Jamshidi needle looks like, So it's just a specialized trephine needle. It's commonly used for bone marrow biopsies. So you have an issue, and I'm suspecting that your blood, that's the parent cells in the bone marrow, they will have issues. So I want to tap them. Okay, take them to the lab and do some analysis. So it's also designed to obtain what? A cylindrical core of bone marrow tissue with minimal crush artifacts. Okay, so it's a cylindrical needle with a tapered cutting tip. Extract a core biopsy specimen of the bone marrow for histological examination. So the tapered end reduces the tissue damage, preserves sample quality. It's available in different gauges and lengths depending on the patient's age. So you can't come and carry the one for adults and be using for children. Do you understand? So it's different like that. So most modern versions are single use, okay, because you can't use it on one patient, you go and use it on another patient. So mainly it's for what? Bone marrow biopsy. This is when I'm suspecting that the patient has issues related to the bone, like leukemia, lymphoma, myeloma, aplastic anemia. So it can also be used for interosseous access, mostly in emergencies. So considerations is usually performed at the posterior iliac crest, that's the hip bone. You can see how the patient is laid down, and of course you are using anesthesia, right, to reduce pain. So it could cause pain, it could cause bleeding, it could cause infections. That's it. So other biopsy needles, we have the Illinois biopsy needle, we have the Rosenthal biopsy needle. We'll talk about them, I think, tomorrow, not today. Okay, today is already 5 something and I'm going to school by 7 o'clock. Okay, so that's it.